Hi there. I apologize. I'm in a unique location, but there's some construction beneath me. I'm going to be presenting my oral speech on Margaret Sanger for FIT's ENT 74 Voices of Civil Rights in American History. What would the world around us look like without the use of birth control and family planning? Would we be trapped in a cycle of poverty, poor health, and societal strain? And what moral duty do we owe the future children of the world in preventing these consequences? Should women not be free from the enslavement of unwanted, undesired motherhood? These are the pressing questions that Margaret Sanger posed in her 1925 speech, The Children's Era, delivered at the National Conference on Birth Control in New York City. At a time when birth control was still a largely controversial topic and an inaccessible option, Sanger passionately delivered this powerful speech that blended both Aristotle's ethos, pathos, and logos with other rhetorical devices to advocate for women's rights to choose. Today, I will inform you of the life and times of Margaret Sanger, a pioneering advocate for women's reproductive freedom, highlighting her background, rhetorical skills, and legacy. Historian Deborah Michaels for the National Women's History Museum shares that Margaret Sanger was born on September 14, 1879 in Corning, New York. She was the sixth of 11 children. Her mother, Anna Higgins, conceived 18 times with 7 miscarriages and 11 successful births. But the physical toll was devastating and she died at the age of 50. Sanger's father, Michael Higgins, was a stones mason who suffered from alcoholism, which often left the family in unstable conditions. The children grew up in a home marked by grief, poverty, and lack of stability, and these early experiences left a deep impact on Margaret, especially the idea that women's bodies were paying the price for society's silence on reproduction. Despite a difficult upbringing, Margaret Sanger attended Claverack College, and she completed her nursing degree at White Plains Hospital. Afterwards, she married William Sanger in 1902 and had 3 children. In 1910, the family moved to Greenwich Village in New York City. There, she joined progressive political circles of the time. She mingled with figures like Emma Goldman and Upton Sinclair. Margaret became active in labor strikes and women's rights protests, but it was her work as a visiting nurse in poor immigrant neighborhoods that changed the course of her life. She mostly cared for women living in overcrowded tenements with limited education and no access to birth control. Sanger witnessed women suffering from too many pregnancies, miscarriages, and even dangerous and illegal abortions. One case in particular haunted her. Sadie Sachs, a woman who passed away from self-abortion. That moment became a turning point for Sanger. This wasn't just a medical tragedy, but it was a moral failure. After the death of Sadie, Margaret Sanger made it her mission to transform family planning and save lives. In 1914, she launched The Woman Rebel, a radical feminist publication that openly advocated for birth control, a term she helped to popularize. The newsletter broke the Comstock laws, which banned the distribution of these materials, and Sanger was indicted on multiple charges and faced arrest. Rather than to stand trial, she fled to England, where she studied birth control methods with leading medical professionals. While she was there, she continued to publish educational materials and had friends distribute her pamphlet, Family Limitation, which offered guidance on contraceptive techniques. She returned to the U.S. in 1915 after the death of her daughter Peggy, and public sympathy led to charges being dropped. In 1916, she opened the first birth control clinic in the United States, located in Brownsville, Brooklyn. It operated for only 9 days before it was shut down, and Sanger was arrested and sentenced to 30 days in jail. The trial attracted widespread media coverage and support. She appealed her conviction, and although she lost, the court ruled that doctors could prescribe contraceptives for medical reasons. Sanger seized on this new loophole and opened a new clinic in 1923, staffed entirely by female doctors and social workers. The clinic would grow into what we know today as Planned Parenthood. Sanger continued spreading awareness until 1921. She organized the American Birth Control League, and in 1929, she helped create the National Committee of Federal Legislation for Birth Control. She was lobbying Congress to legalize and regulate contraceptive access. Despite unrelenting opposition from doctors, conservative lawmakers, and the Catholic Church, Sanger persisted, and in the late 1950s, she secured funding from heiress Catherine McCormick and worked with researcher Gregory Pickus to help to develop the birth control pill, which was approved by the FDA in 1960. By the time Sanger died in 1966, her life's mission to secure women the right to birth control and family planning had been reached. However, it wasn't just Sanger's actions that made her unforgettable. It was her voice. The Children's Era, delivered in 1925 at the National Birth Control Conference in New York City, brought her message to a national stage. To understand why this speech had such an impact, one would need to look at the tools that she used to persuade her audience. Sanger didn't just rely on facts. She used rhetoric to make people feel, think, and act. She drew on all three of Aristotle's ethos, logos, and pathos, as well as a variety of other rhetorical devices that made her message unforgettable. One of the most essential strategies that she employed was ethos, the appeal to credibility. As Studio Binder defines it, ethos is a persuasive technique that appeals to the audience by highlighting credibility. And for Sanger, credibility was imperative. Though she didn't explicitly reference her background in her speech, she did spend years working on the front lines as a nurse in poor immigrant neighborhoods. In these neighborhoods, women often faced the consequences of frequent pregnancies, botched abortions, and poor maternal health. That real-world experience made her someone that the audience could trust, not just as an activist, but as someone who had a lived experience. She understood what was at stake. Sanger also builds ethos when she tells the audience that we are not trying to establish a dictatorship over parents. We want to free women from the slavery of unwilling motherhood. We are fighting for the emancipation of mothers of the world, of the children of the world, and the children to be. With that statement, she frames herself not just as someone looking to control families, but as someone advocating for their liberation. She aligns her message with the well-being of women, children, and the future generations. Sanger also needed that moral foundation because many labeled her dangerous, evil, and immoral. She was accused of undermining traditional family values and was even branded as a eugenicist. It was important that Sanger emphasized that her true mission was to give all women, regardless of class or race, the power to decide. She framed birth control not as a tool of control, but as a path to health and autonomy. That clarity of purpose helped her solidify her ethos. But ethos alone wasn't enough. Sanger also relied on logos, or the appeal to logic and evidence. As Nicholas Whaley explains, logos works by creating meaningful connections between facts, helping the audience follow an argument grounded in reality. Sanger makes a rational medical case for reproductive freedom. She argues that unplanned pregnancies and poor maternal health aren't just personal issues, they are public and health crisis. One of her most striking lines reads, "If we choose to produce strong and sturdy children, the embryo must grow in a chemically healthy medium. The bloodstream of the mother must be chemically normal. Worry, strain, shock, unhappiness, and forced maternity may all poison the blood of the enslaved mother." Her logic was that if we want healthy children, we must care for healthy mothers. And if we want healthy mothers, then we must give them control. She connects these dots for the audience. She links the lack of birth control to long-term social problems, poverty, crime, overcrowded institutions, and dependence on charitable aid. She presents family planning not just as a personal right, but as a logical systemic solution. Her message becomes harder to argue with because it simply makes sense. Still, Sanger knew that it's emotion that truly moves people to act. As St. Louis Community College defined it, Pathos, or the appeal to emotion, means to persuade an audience by purposely evoking certain emotions to make them feel a way that the author wants them to feel. Sanger used this to make her audience feel the weight of the issue and to feel responsible for it. In one of her most memorable sections of the speech, she says, "Trainload after trainload, many unwelcome, unwanted, unprepared for, unknown, without baggage, without passports, and most of them without pedigrees." She compares children to the waves of refugees, abandoned and nameless and overwhelming. She forces her audience to see these children not as statistics, but as kids in a system that was never designed to care for them. Sanger doesn't just stop there. She describes overcrowded orphanages, prisons, and asylums to show how unchecked reproduction leads to the suffering of mankind. When we look at the children's era, we see more than a speech. We see a carefully constructed argument rooted in credibility, reason, and empathy. These appeals are further reinforced by rhetorical devices that made her speech not just compelling, but unforgettable. One of the most powerful rhetorical tools Margaret Sanger uses in her speech is anaphora, which is defined by the Poetry Foundation as the repetition of a word or words at the beginning of a successive phrase, clause, or line. This technique adds rhythm and emotional momentum, creating pressure and intensifying urgency when calling out the issues with society's so-called solutions. She says, "It's not just enough to clean up the filth. It's not just enough to stop child labor. It's not just enough to decrease the rate of infantile mortality." With every repetition, she increases the pressure and forces the audience to realize that existing efforts don't address the root cause. In another phrase, she says, "You have got to give your seeds a proper soil. You have got to fight weeds." Here, she's no longer just naming what's broken, but she's stating what must be done. By repeating "you have got to," she is placing the responsibility on the audience. In each of these examples, repetition becomes a kind of persuasion, turning phrases into something that echoes in the listener's mind. Another technique Sanger uses is antithesis. According to the School of Meaningful Experiences, an antithesis is a figure of speech that states strongly contrasting ideas placed in juxtaposition. It creates a clear contrast between two opposing ideas, and it's a way to make complex choices feel clearer. She writes, "We are not trying to establish a dictatorship over parents. We want to free women from the enslavement of unwilling motherhood." By doing so, she's addressed critics who might accuse her of pushing for control. She reframes her work as an act of actual liberation, dictatorship versus freedom. By using antithesis, Sanger shows the audience that the real threat isn't birth control, but rather it's forcing women into unwanted motherhood. Another device that she frequently uses is metaphors. A metaphor is defined by the Cambridge Dictionary as an expression often found in literature that describes a person or thing by comparing it to another object or being, considered to have similar characteristics. Sanger uses metaphors to paint pictures of complex social issues that feel real and urgent. In one of her most memorable metaphors, she describes society's approach to children as a silly reception committee at the Grand Central Station of life. It created an image of panicked people scrambling as trainload after trainload of children arrive unannounced and unprepared for. It speaks to a system that reacts instead of plans. She continues this metaphor by saying, "If we want to make this world a garden of children, we must first all learn the lesson of the gardener." Here, birth control becomes not just a tool, but a way to nurture life responsibly, that healthy children don't just appear by chance. They grow like plants when they're in an environment that's been cared for. And then she uses another metaphor where she says, "Human weed crops up the speed so fast that in sinister struggle for existence." Here she's harshly refers to children as human weed crop. While it seems almost offensive, she intentionally made this line a little harsh because she wants her audience to recognize the consequences of ignoring reproductive care, not just for individuals, but for society as a whole. She also turns to a technique called a synonym. Sorry, I don't know if I said that right. According to Richard Norquist, an asynodon is a rhetorical term for a writing style that omits conjunctions between words, phrases, or clauses, and it creates a sense of urgency and emotional acceleration. This can be seen in her line, unwelcome, unwanted, unprepared for, unknown, without baggage, without passports, and most without pedigrees. Kind of had to memorize that one. There are no ands in connecting lines, and the absence speeds up the rhythm to feel more frantic, which forces the audience to feel overloaded and a sense of urgency. Another rhetorical strategy that Sanger relies on is the rule of three, which, according to Katie Musgrave, employs three elements: words, points, or syllables to have a reinforcing effect. The device operates on the principle that three of any entity is satisfying, and it presents an easily perceptible and pleasing pattern to a person who receives it. In her speech, she says, happy children, happy women, and happy men. And the structure of this sentence paints a fuller picture. The rule of three makes her vision not just understandable, but difficult to forget. Additionally, while much of the children's era is heavy, Sanger also uses irony and satire to highlight how absurd it is to remain complacent. At one point, she even imagines a world where unborn children could interview their potential parents. She says children ought to have at least the same privilege as cooks. She's pointing out that society demands references, background checks, and a clean house in order to hire a maid, but there's no qualifications to become a parent. So she's used humor to lower the defenses of her audience and to also make them recognize the discomfort. She's forcing her audience to see how hypocritical society's norms have become. Unfortunately, there is no audio or video recording of this speech because of limited technology in 1925. However, its impact endures because of the strength of Sanger's language, structure, and conviction. It's proof that a powerful idea can persist in the absence of technology if communicated well. Sanger's The Children's Era was not just a personal plea, but a direct response to the social and political conditions of her time. As rhetorical scholar Lloyd Blitzer says, rhetorical exigence is the urgency marked by imperfection to which a speech responds. And in 1925, that urgency was rising. Women across the United States were denied control over their own reproductive health. Under federal and state laws, distributing information about contraception was a crime. The Comstock laws classified birth control as an obscene. The consequences were tragic, and maternal infant mortality rates were really high. Child welfare systems were overwhelmed, and families were trapped in cycles of poverty due to illness and constant unplanned pregnancies. This was the imperfection that Sanger was responding to. It was impossible to ignore. The children's era was a call for a change, arguing that birth control was not just a personal choice, but a crucial solution to the economic, social, and public health challenges of the time. Her use of ethos, pathos, and logos positioned her as a credible, compassionate, and informative advocate. She linked reproductive freedom to larger systemic issues, and she used her rhetorical devices to connect with her audience. That's what made Margaret Sanger unforgettable, and her legacy lives on more than her achievements, such as founding Planned Parenthood or helping develop the birth control pill. Her legacy lives on in the ongoing discussions about reproductive rights, bodily autonomy, and the right to build one's future freely and safely. The children's era remains one of the clearest examples of how language, when used with purpose, can shape the world. Thank you for listening.